In this video we will talk about diarrhea, home remedies for diarrhea, causes of diarrhea. Don't forget to like, share and subscribe to our YouTube channel to be notified when we upload new videos daily. Diarrhea is very common, happening in most people a few times each year. When you have diarrhea, your stool will be loose and watery. In most cases, the cause is unknown and it goes away on its own after a few days. Diarrhea can be caused by bacteria. Dehydration is a dangerous side effect of diarrhea. What's the difference between normal diarrhea and severe diarrhea? Acute diarrhea. The most common, acute diarrhea is loose watery diarrhea that lasts 1 to 2 days. This type doesn't need treatment and it usually goes away after a few days. Persistent diarrhea. This type of diarrhea generally persists for several weeks. 2 to 4 weeks. Chronic diarrhea, diarrhea that lasts for more than 4 weeks or comes and goes regularly over a long period of time is called chronic diarrhea. How to treat diarrhea at home. Diarrhea is a digestive problem that causes loose, watery bowel movements. It can be uncomfortable for a few hours or days, after which the symptoms should improve. In some instances, they last longer. Diarrhea can be highly uncomfortable, but most people can effectively treat it with rest and home remedies. Natural home remedies for diarrhea. Normally, as food goes through your digestive tract, the large intestine soaks up extra water. Sometimes, though, it doesn't, and you get rid of the fluid in your stool through the process of a bothersome problem we call diarrhea. While diarrhea often goes away on its own, several home remedies can ease symptoms and speed up recovery. 1. Eating a recovery diet. A diet of small, frequent meals can be better than eating 3 larger meals a day when recovering from diarrhea. A good diet for someone with diarrhea may involve foods rich in pectin, such as fruit. Foods high in potassium, such as potatoes and sweet potatoes. Foods with electrolytes, such as miso soup and sports drinks. Cooked, soft vegetables. Adequate amounts of protein. Some people find that having a liquid diet for the first 24 hours of diarrhea helps settle the digestive system. This may include salty broths, bland soups, and drinks. Adopting this diet for the first 24 hours may prevent the bowels from working too hard. Another option for people with diarrhea is the brat diet. This consists of bananas, rice, applesauce, toast. This diet combines bland foods that are low in fiber and high in starch, which may help produce more solid bowel movements. It also contains helpful nutrients, such as potassium and pectin. It is essential to note that the brat diet is highly restrictive and does not provide balanced nutrition. People should only follow this diet until they are feeling better and not any longer than 2 days. 2. Avoiding certain foods. A person with diarrhea should avoid eating greasy foods. It can help to avoid foods that could irritate or put pressure on the gastrointestinal tract, such as high-fat foods, greasy foods, spicy foods, foods containing artificial sweeteners, foods with high levels of fructose. Some doctors recommend avoiding dairy products, as they may worsen diarrhea in some people. While general evidence for this claim is limited, people with lactose intolerance should avoid these products. It's important to keep replacing your body's supply of water and electrolytes, which include sodium, potassium and chloride. Mix up the perfect electrolyte drink by stirring a half teaspoon of salt and 4 teaspoons of sugar into a liter of water. Add a little bit of orange juice, lemon juice or salt substitute for potassium. During the day, drink the full amount. Start by eating only foods that are see-through, like chicken broth and jello. Broth is an especially good choice, since it supplies your body with water as well as electrolytes from the salt. Stick with these clear foods for a day or two. 3. Rehydrating. Diarrhea causes a deficit of fluids, making it vital to rehydrate. Hydrating the body is essential to recovering from diarrhea. Diarrhea causes a deficit of fluids, including water. This causes the body to lose electrolytes such as sodium and chloride. Dehydration can be dangerous in children and older adults, so it is crucial to encourage them to drink water if they are experiencing diarrhea. Drinking water is the first step to rehydrating. A person can also create an oral rehydration solution by mixing 1 liter of water with half a teaspoon of salt and 6 teaspoons of sugar. Consuming sugar and salt with water helps the intestines to absorb fluids more efficiently. This solution more effectively rehydrates the body after a bout of diarrhea than water alone. Other drinks can also be beneficial. For example, drinking sports drinks can help rehydrate the body and restore potassium and sodium. Fruit juices can also help restore potassium. Avoid drinking anything that will further irritate the digestive tract, such as caffeinated drinks, alcohol, carbonated beverages, very hot drinks. 4. Taking probiotics. Probiotics are microorganisms that can benefit the digestive system. They can support the workings of the gut and help fight off infection. Probiotics are live bacteria and yeasts in some yogurts and other fermented foods. People can also buy probiotic supplements in health stores or online. 5. Trying medicines. Over-the-counter drugs, such as Imodium, can help reduce symptoms and speed up recovery time. Several over-the-counter medications are available for treating diarrhea. Antimotility drugs can help reduce symptoms and speed up recovery time. A common example of this type of drug is loperamide Imodium. However, these medications are not always appropriate. People with bloody bowel movements or a fever should refrain from taking antimotility drugs and speak to a doctor instead. 6. Carrots are another soothing source of pectin. Cook some carrots until they're soft, then drop them in a blender with a little water and puree into a baby food consistency. 7. Eat yogurt containing live cultures like Lactobacillus acidophilus and Bifidobacterium. These help to restore healthy levels of the helpful bacteria in your intestine. Herbal remedies to prevent travelers' diarrhea. Travelers visiting many tropical, subtropical and developing countries run an increased risk of suffering a gastrointestinal illness. These are usually caused by bacteria, parasites and viruses. The microscopic bugs at the top of these rather gut-wrenching, for all the wrong reasons, charts are E. coli, the Staphylococci, Shigella and Salmonella species, Campylobacter jejuni, Cryptosporidiosis, and hepatitis A. Infected food is the biggest culprit, with water coming in second. Ice cream, cocktails served in reused coconut shells, raw seafood, ice, and food from street vendors are potential risks that can interrupt your adventure with less salacious memories to pass on to family and friends. The nausea, stomach cramps and diarrhea from such acute infections usually sorts itself out after a few days, unless of course you have contracted hepatitis A, or something like Giardia. Certainly, if you are unlucky enough to be sick after a few days, you should see a doctor. Fortunately, there are remedies you can take that will strengthen your immune and digestive system and hopefully give your body a better chance at dealing with its new environment. The herbs I describe below would make an excellent traveler's mix. The best form to take them in would be as a tincture, which can be made up by going to a local herbal dispensary if you have one in your area, or alternatively, a local herbalist. Astragalus membranaceus. Astragalus is a good antiviral, antibacterial, and antimicrobial. The polysaccharides in it support the immune system. Astragalus increases the activity of phagocytes, natural killer cells, and the levels of antibodies in the blood. Picrorhiza coroa. This is an Ayurvedic herb that is best given in low doses, as higher doses can cause diarrhea and flatulence in more sensitive people. It's a bitter herb, so it stimulates the digestive system. It is also anti-malarial, supports the immune system, and protects the liver. Picrorhiza encourages all aspects of the immune system, such as B and T cell activity, and the activity of phagocytes. This herb is used in Ayurvedic medicine for liver-related problems and immune problems. Golden seal, Hydrastis canadensis. Golden seal is a gut antibiotic, which for example helps reduce adhesive E. coli, and encourages some immune functions of the body. For example, berberine, which is one of its active constituents, has been shown to increase the activity of macrophages, which digest bacteria and viruses. Barberry also contains berberine, so more information on this very valuable constituent is below. Golden seal, being a bitter herb, it is also good for the digestive system. If you are pregnant or suffer from hypertension, however, you should not take golden seal. Barberry, Berberis vulgaris. Berberine, one of the active constituents in this herb, is an anti-protozoic, which helps protect travelers against Giardia, Leishmania, and Treponema pallidum. Other notable effects of berberine are its activity against Giardia, dysentery, and Candida, as well as the cholera vibrio. The active constituents berberine and palmitoene are also antibacterial. And berbamine, which like berberine is an alkaloid, is a strong antibacterial which seems to work by increasing white blood cells and platelets. The constituent palmitoene is a uterine stimulant, however, and as such pregnant women shouldn't take this herb. Barberry is another gut antibiotic, but it is also anti-malarial, though no self-respecting herbalist would recommend anything other than doctor's treatment if you do contract malaria. Echinacea purpurea or augustifolia. Echinacea is an immune stimulant. Its main active constituents are the polysaccharides and the alkamides, especially the isobutylamides, which are both immune-stimulating, and the polyacetylines, which are antibacterial, antiviral, and antifungal. Echinacea supports the activity of phagocytes, which are part of the immune system, and is also considered antiviral and antimicrobial. One of the ways echinacea appears to work is by inhibiting the action of the enzyme hyaluronidase. This enzyme is used by microorganisms to break down the connective tissue that prevents them from entering and spreading through the body. For these reasons, it is excellent as part of a traveler's remedy mix. These remedies are not designed as a prophylactic, like a vaccine. They work on the principle of giving your body an increased chance at staying healthy. But nothing replaces common sense. Wash your hands before eating. Don't drink ice or from water bottles where the seal has been broken. Drink cocktails in glasses, not cute but probably old coconut shells. Don't eat anything fresh that you can't peel. Don't eat ice cream or drink unpasteurized milk. Be wary of eating from street vendors. Some people do, and are fine. But they are a risk factor with gastrointestinal upsets. It's a good idea to pack some oral hydration salts as a precaution. What causes diarrhea? The cause of most self-limited diarrhea is generally not identified. The most common cause of diarrhea is a virus that infects your bowel, viral gastroenteritis. The infection usually lasts a couple of days and is sometimes called intestinal flu. Other possible causes of diarrhea can include 1. Viruses. Viruses that can cause diarrhea include Norwalk virus, cytomegalovirus and viral hepatitis. Rotavirus is a common cause of acute childhood diarrhea. Bacteria and parasites. Contaminated food or water can transmit bacteria and parasites to your body. When traveling in developing countries, diarrhea caused by bacteria and parasites is often called traveler's diarrhea. Clostridium difficile is another type of bacteria that can cause serious infections that cause diarrhea, and it can occur after a course of antibiotics or during a hospitalization. 2. Medications. Many medications, such as antibiotics, can cause diarrhea. Antibiotics destroy both good and bad bacteria, which can disturb the natural balance of bacteria in your intestines. Other drugs that cause diarrhea are cancer drugs and antacids with magnesium. 3. Lactose intolerance. Lactose is a sugar found in milk and other dairy products. People who have difficulty digesting lactose have diarrhea after eating dairy products. Lactose intolerance can increase with age because levels of the enzyme that helps digest lactose drop after childhood. Fructose. Fructose is a sugar found naturally in fruits and honey. It's sometimes added as a sweetener to certain beverages. In people who have trouble digesting fructose, it can lead to diarrhea. 4. Artificial sweeteners. Sorbitol and mannitol, artificial sweeteners found in chewing gum and other sugar-free products, can cause diarrhea in some otherwise healthy people. 5. Surgery. Abdominal or gallbladder removal surgeries can sometimes cause diarrhea. Other digestive disorders. Chronic diarrhea has a number of other causes, such as Crohn's disease, ulcerative colitis, celiac disease, microscopic colitis and irritable bowel syndrome. What to avoid when you have diarrhea? 1. Avoid fruit juices. Large amounts of fructose can be hard to digest. 2. Avoid foods that are rich in roughage, which can be hard to digest. That means no beans, cabbage or Brussels sprouts. Natural boost for diarrhea. 1. Drink black tea sweetened with sugar. The hot water helps with rehydration and tea contains astringent tannins that help reduce intestinal inflammation. 2. Tannin-rich blackberries have long been used as folk treatments. Make blackberry tea by boiling 1 or 2 tablespoons of blackberries or dried blackberry leaves in 1½ cups water for 10 minutes, then strain. Drink a cup several times a day. Raspberry tea is also said to be effective. 3. Capsules of dried goldenseal appear to kill many of the bacteria, such as E. coli, that cause diarrhea. The key compound in the herb is berberine. Take the capsules daily until the diarrhea improves. 4. Ground up psyllium seeds soak up excess fluid in the intestine, making stool bulkier. They are the key ingredient in Metamucil and in many other natural fiber products. Take 1 to 3 tablespoons mixed in water each day. Methods of prevention for diarrhea. To prevent mild diarrhea, it is recommended not to eat for 2 to 3 hours before bed. Mild diarrhea is a common experience. It may be possible to reduce the frequency and severity of diarrhea episodes by trying the following. 1. Making dietary adjustments and eliminating problematic foods. 2. Avoiding IBS or IBD triggers. 3. Not eating for 2 to 3 hours before bed. 4. Quitting smoking. 5. Establishing a healthful sleep routine. 6. Managing stress with meditation, exercise, and deep breathing techniques, maintaining a healthy weight. 7. Following the treatment plan prescribed for chronic conditions, such as diabetes. Type 1 diabetes is treated with insulin injections or an insulin pump. A person must also check blood sugar levels frequently and monitor their intake of carbohydrates. Type 2 diabetes can be managed with lifestyle changes, blood sugar monitoring, and medications. When to see a doctor. In most cases, it is possible to treat diarrhea at home without consulting a doctor. However, if diarrhea lasts for more than 2 days, seek medical advice to avoid complications. Other reasons to see a doctor for diarrhea include: 1. Blood or pus in bowel movements. 2. Fever. 3. Signs of dehydration, such as extreme thirst and dry mouth. 4. Chronic diarrhea. 5. Diarrhea during sleep. 6. Significant weight loss. 7. Severe abdominal pain. People at risk of complications, such as young children and older adults, should also see a doctor for treatment if diarrhea does not improve with time and home remedies. Warning: none of the information on our videos is a substitute for a diagnosis and treatment by your health professional.